Good morning, ladies and gentlemen. First of all praises be to Allah Subhanahu wa Ta'ala, the Lord of the world, the King of the kings, who has given us guidance, happiness, healthy, and merciful, so we'll be able to meet in this opportunity. Secondly, salawat and salam upon our Prophet Muhammad Sallallahu Alaihi Wasallam, the best figure on this universe, the person who is able to save us from Jahiliyah era. Respectable Vice Chairman of Stikes Mambaul Ulum Surakarta, Mr. Joko Triatmojo, SKEP MKM. Respectable our speakers today, honorable lecturers and staff office of Stikes Mambaul Ulum Surakarta. Honorable, my beloved participant. Ladies and gentlemen, I'm Daru Sukma Putra, the Master of Ceremony in this seminar. I'm very pleased to see you here and welcome all of you to this seminar. Today's seminar is about the role of students in health management in the elderly and the community. Now, I will read one by one the agenda of today. The first session is opening. The second session is sing National Anthem Indonesia Raya. The third session is prayer. The fourth session is speech. The sixth session is presentation. The sixth session are question and answer session. And the last session is closing. Ladies and gentlemen, now we are on the first session. The first session is opening. Let's start our agenda today by saying Basmalah together. Bismillahirrahmanirrahim. The second agenda is sing National Anthem Indonesia Raya. Let's sing the National Anthem Indonesia Raya while keeping the audio turned off. The committee begs to play the Anthem Indonesia Raya. The next agenda is prayer. Prayer will be guided by Mr. Ahmad Shauki Mubarak. To Ahmad Shauki Mubarak, time is yours.
Thank you, Mr. Daru. Bismillah, Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, let us bow our head for a moment, pray to God of Allah SWT, so that our seminar can be precious to all of us. I will lead this prayer based on the teaching of Islam, and those who are not Muslim, you are pleased to pray according to as of your will. Alhamdulillahirabbil alamin, hamdan yuwafi ni'mahu wa yukafiu majida, ya rabbana lakal hamdu, kama yang bagi li jalali wasikal karim wa dimi sultani. Allahumma inna nas'aluka salamatan fid din, wa afiatan fil jasad, wa ziyadatan fil ilmi, wa barakatan fil rizki, wa taubatan qoblal maut, wa rahmatan indal maut, wa maghfiratan ba'dal maut. Allahumma ighfir lana wa liwalidayna wal muslimina wal muslimat wal mu'minina wal mu'minat al ahya'i minhum wal amwat innaka sami'ul qarib mujibud da'wat ya qadiyal hajat. Oh Allah, today we are here to bring about a seminar. The theme is the role of student in health management in the elderly and the community. Make this seminar as a useful Saint assembly and a medium of sharing useful ID, knowledge and experience, and students of various disciplines. May the conference we organize today benefit to our life, broaden our knowledge, send our ID, and lead us to be successful, productive persons, which in turn will boost the dignity of our nation. Oh Allah, get and bless our heart and our mind with the light of your guidance, impart your supreme wisdom upon our activities. Help us to speak our minds clearly, help us to listen to each other, respect each other, love each other, so that we are included to please person. Oh Allah, protect us from unlimited temptation, so as direct that and give us knowledge and strength to perform good things equally, so as and make clearly the bad thing and give us knowledge and strength to avoid them. Oh Allah, you are the one who can fulfill our doa. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun. Wassalamu ala mursalin walhamdulillahi rabbil alamin. Amin, amin, amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Amin. Thank you, Mr. Ahmad Syakir Mubarak. The next agenda is opening and speech. The agenda will be opened by Vice Chairman of Stikes Mambaul Ulum Surakarta, Mr. Joko Triatmojo, Eskep MKM. But before opening, let us to play video of Stikes company profile.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313-KPT-1-2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan, dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi: Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus: 1. Menyelenggarakan tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. Pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. 3. Menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4. Menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, kita perhatian.
To Mr. Joko Triatmojo, Eskep MKM, time is yours. Good morning, Mr. Joko.
Oke, Mas. Thank you. Terima kasih, Mas Daru. Bismillahirrahmanirrahim. Selamat pagi. Good morning. Thank you to the committee of the online seminar today, as well as the speaker who took their time. Honorable Mr. Aris Widianto, Eskepnas MKM, Vice Rector of High School of Health Sciences Mambalulu Jakarta, Stikesmus. Honorable Dr. Joyra Pusat Akop di NSG Assistant Professor Visayas State University, also as our speaker today. Honorable Ms. Astrid Sintara Paramita Duarsa, student of Faculty of Medicine, University Islam Al-Azhar Mataram. Honorable Ms. Evelyn Langsang, student of Visayas State University. Respectable Ms. Ajeng Wafa Amalia, student of Nursing Study Program at Stikesmus. Thank you, Daru, Mrs. Sani, Mrs. Anulus, Mrs. Kori, and Mrs. Santi, as a Master of Ceremony and moderator of this event today. Once again, thank you for the time so that today we can hold an online seminar with the theme the role of student in health management in the elderly and the community. Effort toward the spread of the coronavirus in Indonesia are increasing actively carried out by the government, but the contribution of all levels is also needed. In the current precarious condition, the cooperation of the government and the citizen become effort to jointly reduce the spread of COVID-19. In pandemic, it is necessary to encourage people to be willing to volunteer in facing problem in their respective regions. The role of youth is very important to help the handling of COVID-19. Seeing the total number of COVID-19 cases that are increasing by the fostering community care play role is reducing the impact of COVID-19 in various ways. There are already approximately 15,000 student volunteers who are ready to help deal with the COVID-19 pandemic, with the aim of increasing student competence and contributing real to the nation. Volunteer will focus on helping communication, information, education, and call center services for the community. The increasing need for medical personnel and other support personnel in Indonesia is not balanced by the availability of adequate number of workers. What more, coupled with the number of medical personnel who died while fighting COVID-19. For this reason, the government invite the public to participate in dealing with the COVID-19 outbreak. Currently, Indonesia requires a lot of medical personnel to volunteer, ranging from doctor, nurses, midwife, labor worker, hospital administration, to ambulance driver. In addition to medical colleagues who will be at the forefront of dealing with the pandemic, students will also participate as a second layer by helping to directly combat COVID-19. Coronavirus can be overcome with the principle of working together, increasing self-awareness for others. Indonesia can overcome the coronavirus problem so that community activities return to normal. Seeing the enthusiasm of people who want to contribute making Indonesian healthy again, but from the health sector and other fields as economy that is also experiencing a crisis. Together with partner is providing guidance and advise the COVID-19 pandemic for adherent that has shown. Health and social care worker and local authorities and community group. I will not get tired of reminding all students to always participate in the study both in the field of academic and social activities. So much will come from me. Hopefully our event today is smoothly and can benefit and much as possible for all of us. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Mr. Joko Triatmojo, for opening. The next agenda is speech. Speech from Vice Chairman 3 of Stikes Mambaul Ulum Surakarta to Ms. Aris Widianto, Eskopnes MKM. Time is yours.
Stikes Mambaul Ulum Surakarta, tiada bermesinar. Rangku harapan untuk masa depan, junjung tinggi iman, tegakkan ilmu akhlak mulia, bimbing tugas-tugas bangsa. Sebagai insan Islam bertakwa, tujuan teruslah maju, tak perlu ragu, sukses di depanmu. Pertama tak kenal lelah, masa depan cerah.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. The Honorable Person Chairman of Stikes Mambaul Ulum Surakarta, Mr. Joko Triatmojo, MKM, speakers, and all attendees. We would like to thank all those who have supported today's international seminar. This international seminar was held in order to improve the quality of the implementation of Tridharma in higher education in Indonesia, especially in Stikes Mambaul Ulum Surakarta, and to optimize the role of students in the implementation of learning activities. Hopefully, this event can provide benefits for all. Thank you. Enjoy seminar. Wassalamualaikum warahmatullahi wabarakatuh.
Sekolah Bimbing Kesehatan Mambaul Ulum Surakarta selalu siap belajar bersemangat. Sebagai sivitas akademi yang tangguh dan mandiri, berbakti pada Ibu Pertiwi. Ridho
Okay, thank you, Mr. Aris Widianto, for speech. Ladies and gentlemen, the next agenda is presentation. The presentation will be guided by my partner, Ms. Asrudia Sani Fajria. Hello, good morning, Ms. Sani.
Hello, good morning, Mr. Daru. How are you?
I'm feeling good today. Ms. Sani, how are you?
Yes, I'm good. Thank you, Mr.
You
Daru.
look so beautiful today, Ms. Sani.
Thank you.
Okay, are you ready, Ms. Sani, for
Yes, I'm
this
ready.
presentation? Okay,
Yes.
Ms. Sani, time is yours.
Okay, thank you so much, Mr. Daru, for the time that given to me. Good morning. First of all, thank you to the committee of the online seminar today. Honorable Mr. Joko Triatmojo, SKPMKM, as Chairman of High School of Health Science Membawa Ulum Surakarta. Honorable Mr. Aris Widianto, SKPNAS MKM, as Vice Rector 3 of High School of Health Sciences Membawa Ulum Surakarta. Honorable Dr. Jul Re Ungsang Akop, Associate Professor of Visayas State University, lecturer at Visayas State University, and also as our first speakers today. And Honorable Mrs. Astrid Cintara Paramita Dwarsa, student of Faculty of Medicine, Universitas Islam Al-Azhar Mataram, and also our second speaker, Honorable Mrs. Evelyn Lansang, student of Visayas State University, and also as the third speaker, and respectable Mrs. Ajeng Wafa Amalia, student of Nursing Study Program at Stikes Membawa Ulum Surakarta, and also as the fourth speaker, and respectable for all audience that joining in this meeting Zoom or the YouTube live streaming today. Welcome to our seminar. With the theme, the role of student in health management in the elderly and the community. First of all, let's say thanks to all committee and all audience. It's great that I'm trusted to be a moderator in this first session, and I will be guiding the course of the event with our two speakers, with our two very outstanding speakers. They are Dr. Jul, and then the second speaker is Mrs. Astrid Cintara Paramita Dwarsa. But first of all, before we start our seminar and material today, I will please to committee to have a photo session. So please, all the audience, you can open your camera because we have a photo session together with all the speakers and all the audience. And the committee, please help me to take the picture.
Okay, siap. Okay.
Yeah, maybe for the slide 1, I think.
Okay.
Please open your camera, all of you. Okay, I will count. Please, 1, 2, 3.
Okay.
And then for the second slide.
Okay.
The third slide.
Okay, I'm ready. For that picture.
Okay, you can continue, Mr. Soki, until the 6th slide, yeah.
Okay.
Because so many audience in here. But I will inform you that our audience not only join in this meeting Zoom, but also in YouTube live streaming.
Yeah.
Have you done, Mr. Soki?
Okay, ready. Okay.
Okay. Thank you, Mr. Soki, for helping me.
Okay. Okay. Ready. I will take a picture. 1, 2, 3. The next. One more, maybe.
Yep.
Set. Okay. 1, 2, 3. Okay, enough.
Enough.
Thanks,
Okay, thank
Mr.
you,
Sani.
Mr. Soki. So I will continue to the next session. So maybe for this seminar today, we will have so many speakers exactly, but for the first session with me, we have two speakers. They are Dr. Jo and Mrs. Astrid Cintara. And maybe I will say hello first to Dr. Jul. Hello, Dr. Jul.
Hello, Miss Sunny and the
Okay.
rest of the participants.
Yeah, I think this is our second meeting, yeah, Miss Dr. Jul. Yeah, thank you for joining with us. So the first, before I please for Dr. Jul to give his material, please let me read the curriculum vitae briefly of Dr. Jul Ray Aksen Ekop. Dr. Jul, Associate Professor in Visayas State University. He was graduated from Doctor of Philosophy in Nursing Science, Santo Paulo University, Philippines, Master of Arts in Nursing major in Medical Surgical Nursing, and Bachelor of Science in Nursing. He has published so many international journals and has also experience as a national and international speakers, and including he is one of the recipient of the 2020 Distinguished Nursing Educator Award by the New Delhi Society in Bangkok, Thailand, and has been invited to fill out the nursing lecturer under Dakota program and postdoctoral fellowship program at Erlangga University in the past 5 years. He is also as the project leader for the program FISCARS for 2020 until 2025. FISCARS is a project funded by the Visayas State University, which aim to uplift the service provided by Barangay Health Workers, or BHWW, partners community, and the project deals with the education and the fundamental principles of the community-based health workers and identification of the local resources that are useful, especially on primitive and preventive phases of health management. And so many more of his extraordinary experiences, but I can mention one by one because so many experience that Dr. Jul has. But without wasting time, I will directly invite Dr. Jul to prepare his material today. Hello, Dr. Jul.
Hello, thank you,
Yeah.
Professor Sunny. Yeah, I hope I can be heard right now.
Yeah.
And first, I'd like to say thank you so much for the invitation, the organizing committee, the Stikismus. I don't know how. Selamat pagi muanya. That's for
Selamat
like
pagi
that's a
semuanya,
greeting.
gitu ya, Dr. Jul. Thank you so
Muanya,
much.
right? I hope that we are all fine. And today I will share to you the material which is focused on the management for the elderly and the primary care approach, especially on the community health setting. My greetings to Dr. Joku and the management of Stikesmus. Thank you, Makasi, for the invitation. My student, Miss Evelyn Lansang, will also share the findings of their study about the elderly care in one of her topic or discussion this morning. So let me share to you my screen.
Yep.
And I hope you can see it now.
Yes, we can see your PPT, Dr. Jul.
Okay, for a while. What about that one? Can you now see the screen?
Yes, we can see. Dr. Jul, I give you 30 minutes to deliver your material. Is it enough for you?
It's fine. I can handle the 30 minutes for the delivery.
Okay.
Can you see the slide moving?
Yes, we can see.
Okay. So good morning once again, and my role is to give us an update or to remind ourselves on the importance of elderly care in the community setting or the primary care approach. We know that the COVID-19 really highlighted the role of nurses in the care for the people across lifespan, and it not only provided us the opportunity to practice independent nursing, it also gives us the opportunity to learn on our own way on how to maximize the resources in the community level, because we are not allowed to go on to the hospital. We're not allowed to go on the...
Mas semangat kahit awal kita tanggal itu sudah siap ya. Awal kita diumumkan pas buka bersama itu. Ya.
Sorry, your audience, please mute your speaker.
Thank you. So we can also are not allowed to go on to the clinic for the admission. So really, COVID-19 helped us in reminding ourselves on the importance of primary care, and that is on the utilization on the community resources, and at the same time be innovative in a way as much as we can deliver the best possible interventions to our population, especially on the elderly care, being a vulnerable group. So the emphasis of my topic this morning is to know about the demographics of aging population, both in Asia, in Indonesia, and in the Philippines, and what are those principles in the basic elderly care? What are the innovation that we need to adopt also as a strategy to continue the support system of our elderly, the public policy, and the roles and involvement of nurses in the community-based care. Our topic this morning is focused on the role of student nurses. And I think my student, Miss Lansang, can explain that on her lens as a student. But I would like to focus on the role of nurses. We, the faculty, we members of the academic community, and our nursing students being our future colleagues in the profession. So I would like this material to prepare all of us, not just student nurses, the role, because we can actually study that role when we do our lecture, but I would like you to know more in depth of what really our role, not just a student, but as also a care provider. This is just a statistics that would try to picture the population in Asia. And as you can see, with the population of elderly, which is 65 years old and above, China is the #1 in terms of the top 10 countries in 2020. That is understandable because China has a huge population, and that follows that they also have the greatest number of the elderly group. But would like to focus on Indonesia, which is 6.5%. According to the prospects, the population statistics, Indonesia is at least having 6.5% growth of their aging population, 65 and above, while the Philippines is on a 5%, at least, 5.7% on its annual growth in terms of the elderly population. So although this is not as huge or it's not as big, but this is a good figure to develop plans on how are we going to at least increase the life rate of our elderly. And this is now the role of nurses, knowing that the reason why perhaps they can just only visit the hospital when they feel in pain or when there are diseases that needs really medical or surgical treatment. But what about those elderly who is not complaining of any pain? And we know that as we age, there is also deterrence or depreciation of our physiologic activities. And that is something that we need to prepare, because they are actually experiencing. That's part of their physiologic changes. So again, in this presentation, you see that Indonesia is having at least 7% annual growth rate in terms of the aging group. Now, in terms of the SDG, this is the Sustainable Development Goal number 3, which is focusing on good health and well-being. This is where we focus our presentation. This is where we have to plan ahead of time, because when we plan, it should be futuristic in manner. And our elderly is, of course, most of their physical attributes, physical activities are depreciating. So how are we going to ensure that even if they get old, but they are still taken care of, and our programs should align with the SDG? Now, so this is now the implication. This is now the implication of our population, no, in the aging population to health systems. So as you can see, there is relationship of healthcare expenditure of older adults are considered to be the huge consumer of health services, and the improved diverse cultural and ethnic-based skills caring. Okay, let's discuss the healthcare expenditure. As I have said, there is depreciation of body functions. So usually the elderly are experiencing complaints of bodily aches or bodily pain. And the role of nurses is actually to assist or to aid them in order that they feel a bit of comfort or ease while they are on their transition phase. When you say transition, they are slowly deteriorating, and the role of nursing, the function of our profession is to aid these people to facilitate comfort or easiness, no, in their way out. So another is, as we know, that they are the huge consumer of the health services. So that's why in the Philippines, I believe also in Indonesia, you have this insurance system intended for the elderly or those who cannot perhaps afford with the hospital bills. So the government should ensure that a budget or appropriation is provided in terms of rendering the health requirements or the health services. And as we go along with our nursing practice, we have to consider the diverse cultural and ethnicity of our elderly, the religiosity or the cultural affiliation of our patients. It is not logical that we offer a particular care which is violating to the culture, to the belief of our patients as recipient of this care. So as a nurse, we have different theories of nursing. For example, your transcultural nursing that would prepare us to better understand the role of ethnicity, the role of cultural affiliation to appropriate the care. So if we care for a client which is not sharing the same or similar cultural affiliation, then we need to innovate, no? And we need to innovate in order to for this care to be acceptable. Okay, this is just the cycle, and these are interrelated with each other. When we say successful aging, it means that an elderly should at least engage actively in their social affiliation or social life. No, it is a myth that an elderly should just stay in bed for the most of his life or her life until waiting for when he gets die or to at least breathe his last. But a successful aging, as we prepare for this period, for this milestone in life, we have to plan ahead based on the wish or the desire. Should we live a life fulfilling enough in the retirement period? So active engagement in life, meaning there are activities that the young ones can still associate, or the young people can still also share those type of engagement or in this type of activity. No, another is the possibility, okay, that there might be decreasing risk of disease related disability. I know that the elderly physiologically or physically are experiencing pain or experiencing sickness or ailment because of the age, of the increasing age. But our role is to at least lower the risk or lower the chances of disability related to aging. Therefore, we need to ensure, as a nurse, our role is to ensure the safety of our aging population, considering that they are vulnerable to those activities that may lead to permanent or temporal disability. Another definition, according to our books, in terms of successful aging, is the continuous obtainment of the mental, and physical function. Even if we get age, it doesn't follow that we all experience bouts of forgetfulness, or even if these people are aging, it doesn't mean that forgetfulness or dementia becomes normal. It doesn't follow that way. And it doesn't also implicate that when we get old, we cannot function the way we are doing the course or the activity during our active years. Although, as I've said, there are physical alterations, but it does not mean to say that we really cannot do, or we cannot perform the optimum physical functionality. Okay, so the principles of primary care. So we are talking now of the community health setting. We're talking now on the management of vulnerable group in the primary approach. First is good communication. As a nurse, as a role of a nurse, as a good communicator, you were able to associate the relationship. You even master the skills for performing independent assessment, for you to directly assess or diagnose the patient's state of condition, state of health. So it is expected that as a nurse, we don't have medical doctors in that field, because we're talking of primary care or independent care. You have to exhaust all your means to identify or to rule out the patient's genuine state of conditions. So the communication here is both the verbal and the non-verbal skills in eliciting information. Another is integration of biopsychological spiritual care model. Now, this refers to the aspects of human being. Bio means the physical aspect. The psychological means the state of mind. These are also important. And the spiritual aspect, no, and the emotion as well. Literatures mentioned that for the elderly client, aside from the physical requirements, they are more after of their spirituality. No, when you say spirituality, this refers to our beliefs to somebody whom we believe to be of a person of supernatural power. I am talking of example in for Christians, we have our God. In Muslims, example, in our brothers and sisters in Indonesia, you have Allah, right? So we need to consider the spiritual life of our patients, of our elderly. No, we need to integrate every time we care. We always consult, we always assess their spiritual well-being. Family and home care support. It is important that when we care for the elderly at home setting or the community setting, we involve the family members as our partners towards better care rendition and the continuity of care. If the time really demands that the condition of the elderly is something that needs medical treatment, a medical doctor, or other members of the medical team or the paralegal team. So they will be confined in the hospital for close monitoring for further diagnostic examination. Then at the end of the day, like 2 or 3 days after the hospital stay, your role is to ensure that the continuity of care is provided even at their home setting. So that's the reason why we need to actively educate our family members and other stakeholders on what had happened to the patient or what are the things that we should do or prepare to provide at least an ease or comfort even at the outside of the hospital environment. During the COVID-19, a systematic review of literatures mentioned or summarized these 3 important innovations in the community-based management, meaning to say, even if we are outside of the hospital premise, the management for care, the management for elderly patients is possible at the primary level approach. First is the private-public partnership. I am referring to the different interested government or non-government institution or organization which focus or mandate is on the elderly care. I know that in Indonesia we have this KEDER or cadre. I hope I remember that right. It's KEDER or cadre. That's in the community level, and their role, their function is actually to assist the care, not just for the elderly, but also to people in the village on the proper way of doing promotion and prevention levels practices. In one of my extension program, I think Professor Sani mentioned that about the community health program, which is the VisCares. This is a program funded by our university in order to augment, to capacitate our community health worker in the KEDER or cadre to do most of the promotion practices and the prevention deliverables at the community setting. And we are planning right now that we will include this as part of our agenda for the internationalization. So I hope that your institution, the Stikismus, when we have already our MOU or MOA, we can have this kind of activity. We will be actually expanding our scope in the capacity training of the community health workers, because they are the frontliners, especially in the period of emergencies. especially if the hospital is very far from our village. We really need to have that first aid, and we don't have that luxury of nurses placed in those communities set up, because most of our nurses are expected to be employed in the hospital, or others will do migration. They will go outside of the country for work for a better salary. But we need to empower our community health worker on the first aid, on the proper assessment, that even without the presence of a doctor or trained individual, at least they're giving the first and immediate care at the community setting. That is to increase the survival rate of our patients. So that's one of our community-based management support. We need to partner with other agencies, with other institutions, but the aim is the same, and that is to enrich the engagement towards management at the community setting. Another is the assistive technology. We belong in the industry 4.0, and the technology, the use of technology is very important. Just what happened in the most of the institution in local and abroad, that we deliver our lecture, we deliver our webinar, we deliver even our meetings and engagement through virtual means. And that is possible because of assistive technology. Now, in the community-based management support, we have to properly use the technology that is appropriate, that is sound, that is important, that is appropriate for the care for our elderly. No? So we need to empower also our workers about it. And the home care setting. The home care is the extension of the levels of management. We have 4, from the promotion down to rehabilitation or recovery phase. And the home care is the best environment where the patient, where the elderly can recover or recuperate after admission period. So we have to prepare the home care setting as a conducive environment for the said recovery. So public-private partnership, the home care, and the use of appropriate technology are those of the common tool that we have to consider when we develop our plan. This also refers to the public policy development. I see that some of the nurses are holding office in the government, in their province, in the national level. And it is a good indicator that health becomes a priority agenda in our community. And we need to inform them that the delivery of care is until at the community setting. It will not stop in the hospital level. So these are areas of public policy development. We need to emphasize wellness and health promotion. We should develop activities that will enrich the health promoting activities, the wellness experience of our patients, of our elderly, not just the elderly, but people across ages. Okay, so this is the very important policy that we need to create or to make programs with. How are we going to preserve the wellness and the promotion levels of our population? The long-term primary care, as I've said, in Western countries, in the UK, for example, or even in the US, they have home for the shelter for the elderly, home for the aged, home for the vulnerable population. But our culture in the Philippines, and I believe we have same culture in Indonesia, that when we have elderly people, we live with them. We have our grandparents, we have our aging population. I mean, yes, our grandparents living with us in the same roof, in the same shelter, and we do not put them isolated, no, or in isolation. So we have to educate the family members. We have to enrich the home care setting, because this home care environment can be considered an avenue for a long-term primary care. It is not feasible that we really have to build a strong foundation or build another facility where we put all them together in one place. Our home care, our home environment is a good avenue for them to experience, no, at least association with their family members, even if they get old. And our role is to train the geriatric advocates for as a care provider. We have to train them. This is a specialized area of nursing. We have different specializations or field of nursing, and not all are loving to be a geriatric nurse or a gerontology nurse. But we have to let them feel that this field is really needing our young nurses, our students, to fill in the gap, the shortage of nurses with the specific specialty in geriatric care. So these are areas for public policy. This is now the roles, and as I've said, this will be discussed maybe in most of other lecturers. Our role is to make ourselves experts. We have to be experts in our own field, and we have to join organizations to analyze the elderly care related concerns. So when you graduate, when you become nurse, you have to join local or national or international organizations and try to discuss agenda or issues that would promote the welfare of the elderly, provide testimony at the legislative and public hearing about healthcare. So our experience is actually something that we need to give. We need to share in a talking table. Our idea should be translated into a way to develop programs that is doable in order to improve the lives of our elderly people in the primary level. We can also serve as members of the committee charged with studying healthcare reforms or the activities towards elderly care and advocacy agenda within and outside of our policy. This is a moral imperative. Well, when we become nurses, and I know that our students will become in the near future, it is not just the salary that you need to think of when you work. You also have to consider what is the moral contribution of you being as a nurse towards humanity. You have to pay back to the humanity, whatever in a way you can, in order to give justice of our existence as a nurse. We have to be employed. You have to look for security in terms of your economic security, and at the same time, try to consider joining or developing advocacy program for the least, and for the lost. No, so I'm referring to the people who are underprivileged and who are economically challenged, that you can help them in a way you can. Those refers to your moral imperative. Those are advocacy agenda. So I think we are all knowledgeable about the standards of gerontological practice based on the 1987 ruling. So it says that all gerontological related nursing services are planned and organized, meaning we have to plan ahead of time. It should be organized before we execute or we implement the plan. We need to upgrade our science of elderly care through engagement in scholastic activity like theory testing, or when we engage in research, when we publish, when we make research and activities like this to disseminate the findings. And this environment, this platform, this is a very good platform organized by Stikismus for us to know the findings of other country, of other schools, and we develop decisions from there. You know, the language of decision makers, the language of our managers, the basis for Professor Joko to make judgment, to make decisions, should be coming from research, because we cannot attain care at its best. We cannot provide sincere care, no, caring with sincerity. We cannot do sincere care if we do not know the actual statistics. And so it is part of our standards that before we create programs, before we make implementations, we have first to generate the knowledge, and that is possible through making research, engaging to webinars or seminars like this. Another standard is assessed comprehensively and systematically the status of the elderly. We have to go back with our fundamental function as a nurse to be very good in terms of our assessment. Now, our nursing process, and I will not discuss the nursing process here, okay, from the assessment down to evaluation. That is our only tool to identify the status of our elderly. Another is we nurses are using assessment data to determine nursing diagnosis. That's the nursing process. We all students, all student nurses should have practiced, you know, carefully, or at least encountered the process of nursing, the process of nursing from the assessment down to evaluation. We need to develop the plan of care based on the data that we have. The data, it could be the subjective as verbalized, objective based on what we can see, what we can feel, based on the instruments that we use. Then we generate plan based on our assessment. The nurse as a role, one of the roles is, aside from the planning, aside from assessing, we also give and implement the intervention. And the intervention now in the primary level is more on the independent nursing action. What you can do in order to save the life of this patient at your own capacity. You are with yourself. You are giving interventions based on your knowledge, based on your understanding, based on your skills, based on your appraisal, based on your judgment. What will you do in order to improve the life of your patient? And that is a primary approach. And worst comes to worst, if you cannot really address the need, at least you maximize your function, you maximize your resources. In the last stage is you have to refer. But please do not get me wrong. Do not refer immediately without you trying your best to address the problem of your patients. So those are the rule standards of gerontological care. We need to continually evaluate, as I have said, after assessment, after you give intervention, you have to evaluate and reevaluate and reassess which of the area you get, you know, a poorer performance, or which area that you need to maintain because it provides a good promise. It gives intervention to your patients. So you have to evaluate all of these data. You have to include the family responses, because we know that they are important as well to carry out better implementation of your plan. You have to collaborate. It is a known proverb when you say no man is an island. So you have to work with a team. You cannot do it yourself. Although we encourage everyone to individually practice nursing, but it is important that we have to ask for help sometimes if ever our resources are exhausted and still the patient is not responding positively to the intervention. So you have to collaborate. You have to engage in research, as I have said, because our profession is evidence-based profession. We cannot just implement without backed up from science, without further study or scientific study from research. And always observe the ethics that we are governed. We are governed with the ethical code of nursing. We have the International Code of Nurses. We have our code of ethics from Indonesia, from the Philippines. So we have to abide with that. Okay, so those are our roles as a nurse, not just a student nurse, but as a nurse. So with that being said, thank you for listening.
Okay.
Good morning.
Yeah. Yeah, thank you so much, Dr. Chul, for your interesting material. I think your material very complete, yeah, to give our knowledge and insight about health management for the elderly, especially. So for the next session, we have a question and answer session. So I will invite all the audience in here to give your question, maybe to about the material that Dr. Chul given to us. Please, for the audience, maybe, do you have any question? Maybe before the audience, we have some discuss about about this topic, Dr. Chul. As we know that providing safe primary care is more challenging for the elderly patient with the multimorbidity maybe. And healthcare management for those patients requires a collaborative approach to provide closer monitoring, as you said on your material. And recently, the COVID-19 pandemic is highlighted the challenges of frailty and safety of the elderly population as a global health concern. And maybe the elderly population are not only at a higher risk for contracting the COVID-19 pandemic and suffering a worse outcome from it, and they may also be at risk of neglect or their pre-existing chronic condition or being lost to follow up. But maybe can you show us about maybe there are some programs may have been done in Philippines and maybe applicable in Indonesia to support and optimize the quality of life of elderly health? Maybe, Dr. Chul.
Yes, thank you for raising that a very challenging question because although we are all in the medical field, no, like members of the academic community, and our mandate is slightly different. Our, like, we are told to educate our students, we are told to produce professionals as part and parcel of the nation's workforce, more or less, to healthcare, to nursing, to midwifery, to medicine, to pharmacy and the like. In terms of the program, our program right now, as I've mentioned, it's not directly towards the elderly, but it is more towards enhancing the skills and potentials of the community-based health workers. And that is one of the programs I have said regarding the VISCARES. That's why I made mention earlier. This is a community extension program of the college, and we are planning this to expand in a national or even in Asia scope, no, in Asia, as part of our direction for internationalization. And that's why I made mention if it's possible that the Stikismus can be our collaborator in this implementation. We will be implementing same program, and we are going to create a, what do you call this, a strategy that is culturally sensitive. When you say culturally sensitive, because no matter how good the program is, but it is not fitting, it is not something acceptable in your end as having also a different culture set from us, so it will be useless. So that's one of our strategy, or one of our direction for internationalization. Right now, the Visayas State University is always telling us to have this internationalization program. We need our university to be globally visible and to be globally, what do you call this, to be globally responsive. That's why I presented to earlier the UN SDG, and we would like to place program that would hit one of the different agenda of the SDG. So when we make plans, when we make activities for internationalization, we make sure that we address at least one or two of the SDG programs or mandates. So going back to your question, if what are other programs aside from that, aside from those extension program, Philippines is prone or is experiencing disaster, natural disaster or calamity. Just had recently, we had two disaster or strong typhoons that really, experienced by our citizens, our constituents. There were mudslides and all. And in that experience, how we being an institution is responsive or will become responsive. So immediate, well, that's the rule of thumb that we really have to give immediately their needs for immediate survival. But in the long range, what are other programs that we can do that is something lasting, that even if we go out from this community, they will be able to stand on their own. They continue to live without our presence. It is different when we say that we dole out things, like we give them food for now, and then after that, so no more food for the rest of their lives. So that's not the idea of being, community responsive or resilient, or at least we are significant to their existence, that we create program, we create plans that even if we go out from their picture, from that picture, they still continue to live, and with minimal supervision from our end. So there are a lot of programs, and I think you have programs also in Stikismus that we can also benchmark and we apply here in our country or in our institution. These are evidences that we really are moving towards helping each other across oceans, across borders, because we're very far, but it is possible. It is possible. So again, when you ask me about the program, we have this community extension program, aside from our mandate of producing globally responsible citizens in the nursing field.
Yeah, a very, very amazing program, I think, that you said before. Maybe in here, there is audience that want to discuss or asking with you, Dr. Joe. And she is Mrs. Ayu Anulus. Hello, Mrs. Ayu Anulus.
Hi, Mrs. Ani.
Yeah. Okay, Mrs. Ayu Anulis is from Medical Faculty from University of Al Azhar from Nusa Tenggara, West Nusa Tenggara, ya, Mrs. Ayu Anulis. So
Yes.
she is not from Stikismus, but another faculty. And maybe Mrs. Ayu Anulis, what will you ask for for Dr. Jul?
Okay, thank you, Mrs. Ani. I have one question for Dr. Joe. Dr. Joe, maybe you can share your personal experience about how to taking care the elderly with dementia. Thank you.
Yeah, okay. Personally, I don't have the experience, direct experience of taking care with an elderly with dementia, but I had experience taking care of my own grandparents who have bouts of being forgetful. And although it's not dementia because it was not scientifically or medically diagnosed that they really are experiencing dementia, but the display of the like being anxious or agitated sometimes, that my experience is really to have this very very long patience in taking care of these people. Sometimes you need to adjust yourself and try to understand, to widen your comprehension why they are behaving or reacting this way. You should not should I say you should not give the exact amount of behavior that they are displaying. No, as a nurse, as a provider, you have to educate yourselves based on the different theories that you have. And in my end and my personal experience, I think this is that was an advantage for me because I took care of at least 3 of my grandparents before they die. And so that's roughly 3 to 4 years. And the unique part there is you don't have the option being the nurse in the family, because you cannot just ask somebody to do the thing for you. You cannot delegate those tasks. That's why they said, or my mom informed me that that's the reason why we ask you to be a nurse, so that when we get old, at least there is a nurse in the family who would really take care of us. And in taking care of this elderly, aside from the patients that you need to consider, is you have to free yourself from the bias of your own self. If you have a negative experience taking care with an elderly, or if you have this traumatic experience or a relationship towards a very it's nightmare experience for an elderly patient, it follows that every time you see an elderly, you always have a negative connotation towards them, and it leads you not to be open, not to be as much caring as our profession desires for us when we care these people. So even if you go on the hospital and you see elderly client, even if that is not a family member, you always have a bias to yourself, because you have a traumatic or negative experience from other people, especially the elderly. So the patients, another is to identify your own bias. That might be a ground that you would commit error, or you commit abuse unintentionally, because you don't want to have a relationship, you don't want to care to begin with. That's why sometimes your presence is there, your physical presence is there, but the way you act, the way you communicate, the way you engage in the performance of caring is not authentic. It's not real. You are just there to complete the hours requirement for you to go on duty, but your presence, your heart is not actually on that period in the interaction. So those are just my experiences. And aside from the medications, these are usually prescribed medications from their doctors for the long-standing diagnosis. In the care for elderly, there is a lesser need for a medication. Our golden rule in taking care of the elderly is assisting them to provide comfort as they wait for their time, or before they die. At least we give comfort. That's actually the mantra of our profession. If we cannot give them a good recovery, at least we facilitated easiness or comfort towards death. That's our calling as well as a nurse. So those are just my experiences as a personal nurse for my grandparents.
Yep. Okay, thank you so much, Dr. Teacher, for your good answer. And thank you, Mrs. Ayu Anulus. And maybe from another speaker, maybe from Mrs. Astrid or Mrs. Ajeng, do you have any some topic that you want to discuss with Dr. Chill, maybe? Mrs. Astrid or Mrs. Ajeng or Mr. Aris?
Maybe I would like to say thank you, Mrs. Ani.
Yeah, please, you can say thank you.
Thank you, Dr. Joel. So in the end, we should always be prepared to become personal nurse for our family, right? Taking care of them and give comfort at least. Thank you so much. Salamat.
Sama-sama. Actually, I type in my email and my WhatsApp number, because if you have some questions that you can think of and the session is over, you can still reach me to increase or to give something, or if you ask me to give material about elderly care or publications related to elderly care, it's actually for free. So you can reach me. This is also my advocacy, because I mentioned about advocacy, and the advocacy is not only contained in my country or not just in my institution. It should be to at least in a global perspective. So at least when I was not able to take care of the Indonesian elderly through you and through my mentorship, it is as if that I am able to take care of your older populations in your place.
Yeah, thank you so much, Dr. Chilo, once again. And
Mrs. Ani?
Yeah,
Miss
Mr.
Ani?
Aris?
Yes. Okay. My question out of the topic.
Yeah, it's okay, please, Mr.
Yes,
Aris.
of the topic. Mr. Joel, thank you for a great presentation, 1 and 2. Mrs. Ani, Mr. Joel have visited to Indonesia?
I think Mr. Cho have visited.
Yes, I visited Indonesia in 2015. And every year, 2015, 2016, 2017,
After
2018.
pandemic.
And it just ended when the pandemic struck.
Okay.
Actually, that's part of my, of my calling, perhaps as a nurse, to have a widespread of information. I've been to, I forgot the place. I've been to the Ponorogo,
Ponorogo, right?
In East Java, in Timor-Leste, in Pelita Harapan.
Oh, Pelita Harapan, right?
Yeah. And in Jakarta, in Yogyakarta, in Malang. Well, these are the places I've been visiting, and I was able to provide lectures and of course disseminate the findings. And What else? Of course, I miss the bebek goreng and
Oh, you like bebek goreng? Okay.
Nasi goreng, nasi
Nasi
goreng.
goreng, nasi
nasi
rendang.
goreng.
Oh,
Well,
nasi-
anyway, those are just part of the
Okay.
Indonesian culture, and that's why I
Okay.
see I
Uh-huh.
see that there is really association between your culture and our culture. So it's not easy. Oh, it's not difficult for me to adjust.
Okay.
Sometimes when I don't talk and last time during my travel in Indonesia, I have to buy that box of the bebek goreng because I need to bring that back home. However, the embassy or the consul did not allow me, so I need to eat the $5 before I go out from that international airport. But I cannot afford to throw it away, so I really have to eat all of this for the next 2 to 3 hours before I depart for my plane. But what I'm trying to say is there is really a thin connection between our culture. That's why it's not difficult for me as part of the internationalization plan to mingle or to associate or to tap with our Indonesian counterparts to implement the said program. And your practices would be a good benchmark, so we can also improve our healthcare here, and you will also learn from our innovations that you can also impart in your field when you go back to Indonesia. So those are, some of the funny experiences I had. Sometimes I have to eat the suha all day long. Whenever I have my travel from, I need to travel by train that time. Yeah. But anyway, those are just my experiences, and it was just tough because of the pandemic.
Okay, bebek goreng. Okay, Sani, Ayu, next agenda, we comes to Philippines, right?
Yes, of course. So,
Visit the Philippines.
Actually, we have 2 foreign students from Indonesia last semester. They were enrolled via online from the Stikes Bethesda Yakum.
Oh, Yakum.
And
And Yogyakarta.
And in Yogyakarta. And in by next semester they will hopefully send another 6 in our institution. But this time they said as much as possible they want their students to come here physically for 3 months and then 2 months hybrid. So I just communicated with the International Affairs Office. Again, this is actually part of our mobility, our internationalization. For us to be seen, for us to be seen on the map for internationalization. So your plan of coming here, you're very much welcome. Just inform us so we can also arrange our obligations or our possibility. And I'm also that's why I've mentioned this, because our plan for internationalization is for the mobility of faculty. So when you come here to do your lecture, perhaps for one week or 2, then we also send our faculty there and we'll perform the lecture. That's at least the way we can do in order to have these shared resources, shared knowledge between your students and ours.
Of course, Hani, we can join research, right?
Yes, of course. I think so.
Actually, we have 2 students, as I've said, from Bethesda who were enrolled in nursing research last semester. So some of them are collecting data from Indonesia, and also the counterpart is doing collection of data here in the country.
That's good. That's
But
good.
that's a very what do you call this? Welcoming opportunity for all of us.
Okay. Thank you very much, Mr. Jul.
Okay,
Mrs. Hani, thank you, Mr. Ayu. Mrs. Ayu, thank you.
Yeah, you're welcome, Mr. Ari. So maybe I think For this session have done for the first speaker by Dr. Jul Ray Akop. So maybe Dr. Jul, if you have another agenda, you can leave from this meeting Zoom first, and we can continue to the next agenda. But once again, thank you so much for your coming in this meeting Zoom, Dr. Jul. I hope we can have another cooperate between us in the next agenda maybe.
Thank you so much. I will just have to log out and be back because I still have a student to present her paper.
Okay.
And that's also part of our commitment to, this is our first time really to send our student for an international conference.
Oh, okay. Good.
Thank you very much for that opportunity.
Don't forget to send me your material, Dr. Jul. So I will give your material to all audience in here. Okay, thank you.
Thank you so much.
So for all the audience, we will continue to the next agenda, and the next agenda we will invite for Mrs. Astrid Duarsa from Medical Faculty of Al Azhar Islamic University. So maybe for the first, I will say hello with Mrs. Astrid. Miss Astrid, yeah. Hello, Miss Astrid.
Hello.
How are you, Miss Astrid, today?
Well, absolutely amazing to see you guys.
Okay, Alhamdulillah. Nice to see you too, Miss Astrid Duarsa. Miss Astrid, are you ready to deliver your material?
Inshallah, I'm ready.
Okay. Without waste the time, so I will please for Miss Astrid Duarsa to deliver your material.
Okay, let me share screen first.
Yeah.
Wait.
Before you deliver your material, maybe you can introduce by yourself briefly, Miss Astrid, because I think all the audience in here want to know about you.
Okay. Good morning, everyone, and welcome to my presentation. And thank you for Stikesmus and VSU for the opportunity. And let me start by saying a few words about my own background. So my name is Astrid Duarsa, and I'm a medical student of Al Azhar Islamic University, batch 2019. And I'm brand ambassador of West Nusa Tenggara Scholarship, and I have passion on medical education. And that was led me to become chief executive of Medical Research Scientific Avicenna Club. And well, it's one of student organization in my university. As you can see, can I start the presentation, Miss? Okay.
Of course, Miss Astrid.
Okay, as you can see on the screen, our topic today is enhancing elderly's quality of life, and well-being through safe tourism activities. Okay. My talk particularly relevant to those of you who really care with your grandparents or your parents and want to increase their quality of life and well-being and make them happy as well. Okay, so educating the mind without educating the heart is no education at all by Aristotle. So this is Medical Faculty of Al Azhar Islamic University's core value, and that make us as a medical student not only think being only a mediocre doctor, but make us a doctor who passionate and care about our patient in the future. So as we know, what is elderly? Well, the Center for Disease Control, or CDC, and Prevention defines an older adult as someone who is at least 60 years old. Many states may also have different definition of elderly when determining what resources are available in cases of elder abuse. Although most states commonly use 65 years of age as the cutoff. So the older adult is 60 years old and elderly is 65 years and more. Okay, what's the difference of elderly people in developing countries like Indonesia and elderly people in developed countries like USA, like Germany, and many more? So in elderly people in developing countries is more vulnerable, like already Dr. Joel said, and dependent without power or influence. But in developed countries, they are prepared for the old age, already prepared, and they more independent and already financially stable. Sorry. Okay. So the development of the concept of successful aging that already said by Dr. Joel has inspired considerable interest in healthy aging, active aging, and productive aging as strategies to overcome these problems. The process of active aging acknowledges the value and importance of maintaining good health for adult adults while remaining in their usual environment. This view has stimulated research into active aging with emphasis on the development and maintenance of abilities and skills that lead to a greater sense of well-being. So what is quality of life and well-being? Did you guys already know what is quality of life? Well, quality of life is about how you know what is good about how to increase about happiness while you doing aging. Okay. In modern society, people consider quality of life in terms of material abundance and mental relaxation. Hence, many scholars have identified the concept of well-being perception, or we can call it as a WBP, in diverse fields. So the concept of WBP, or well-being perception, is important to senior tourism or elderly tourists because older citizens have been shown to want to take trips to meet the needs of their well-being. In other words, the elderly desire to increase their quality of life through travel. And elderly prefer the organized tours to ensure a safe journey and the immediate assistance for any unforeseen problems during travel. The growing interest in reflected into packages which are excursion or holidays in a group led by a tour guide with a combination of various services. On the other hand, WBP, or well-being perception, has been spotlighted in the tourism context as more tourists are concerned with the quality of life, and this equally applies to the senior tourism industry. Physical activity assists in maintaining independence throughout life as well as improves quality of life. Together with the accelerated aging phenomenon, the growing attention and well-being is notable in today's society and creates new opportunity in the tourism industry, especially in Lombok. West Nusa Tenggara, it's a really good opportunity for tourism industry to really care with elderly people. The value of tourism has been included in studies of active aging, and the existing public health implication on the physical and mental health effects of tourism among seniors are recognized as quite important issue. Well, according to the research, there's an elderly woman, 62 years old, and already retired for 2 years. She said like, oh, finally I have retired, but I still want to enjoy life. I retired first and my husband is still working. Every day I awake to a life that seems very empty, she said, and I miss all the outdoor activities and my friends to feel the same. And suddenly I understand that I have a lot of time for my favorite outdoor sports and to engage in long distance travel. I no longer need to worry about my children. They have their own families and my husband is still working. And there's another elderly. She's 67 years old, already retired for 5 years. She said, like, it took me a long time to adapt after retirement. Even still, I sometimes feel abandoned by society. My children have grown up and are busy at work. Before I retired, I travel quite frequently and I still need to be mentally prepared to maintain a high frequency of travel after retirement. Some of my friends who used to travel together have minor illnesses, and some have chronic conditions, so they can no longer engage in long-term travel. So here's elderly as senior tourists. The literature has yet to offer a university agreed definition of senior tourists, with definition ranging from participant in tourism activities who are over the age of 50 to studies that define senior tourists as being over 60 or even 65, like I already said in the first presentation. Most studies show that seniors' motivation for travel is mainly for increasing their quality of life and well-being, of course, to pursuit of happiness, escape from daily life. Like, you know, sometimes daily life is such a boring thing, nostalgia and lifelong learning. But sometimes there are also limited factors like physical weakness. And here's the key driving value elements of active aging. I'm more focused to tourism well-being values. There's something that we should increase, like emotional communication, social support, and then physiological value that we can talk it with a psychiatrist. And here's tip-centric traveling for elderly. So the first one, we have to be prepared before doing travel. I mean, like pre-travel. First, we still in not pandemic, but we still have to prepare for COVID-19, and you have to make sure you are up to date on all of your routine vaccines. I mean, vaccine 1, vaccine 2, and vaccine 3. And then you have to know your health status. Make an appointment with your healthcare provider or a travel health specialist at least 1 month before you leave, and take recommended medicine as directed. Like in Indonesia, we call it as P3K, right? And then plan for the unexpected. Get travel insurance and prepare for emergencies. And don't forget to pack smart. Prepare a travel health kit with items you may need. And then while during travel, don't ever forget to use your mask and wash your hand. And then choose your transportation safely. If you feel safe with the plane, then go on. And don't forget to avoid the insect, bite insect, like bees or mosquitoes, because we never know that was the endemic area to, is that malaria around there or something. And there's avoid to animal like rat like this, maybe. And there's don't ever forget to using sunscreen. And you know, there's gonna be a unpredictable situation like waves or something, or earthquake, so you have to be prepared and looking for some research for it. Okay, and then after travel, I mean post travel, you can contact your healthcare provider if you do not feel well. Sharing the following information may help. And first, your vaccination history. You should tell them where you traveled, your reasons for traveling, your travel activities, including swimming, hiking, etc., the time frame of your vacation, where you stayed, such as hotels, family or friends' home, hostels or tents, what you ate and drank, animals you had close contact with or touched, even if you have any injuries or scratches or insect bites, healthcare or medications you received during your trip, and close contact with other people. You should still tell them, including sexual encounters, if you have a dangerous situation. And for senior tourists, there's a role important then, since they may experience difficulties during a trip. Consequently, senior tourists tend to rely more heavily on their tour guide during travel. So here's the tourism attractiveness of senior-friendly destination. Then here's the conclusion. Several studies have noted that tourism positive affects elderly subjective well-being and quality of life by enhancing their self-esteem and confidence, given the potential for active aging to generate positive improvement in the overall health of all seniors, including their physical and mental health. Activities that stimulate active aging, including tourism, have emerged as an important research area in factors related to elderly health. So here's the research that I already read. So maybe that's all I can say. Thank you so much.
Okay, good. Thank you so much, Miss Astrid, for your interesting material about senior tourists. Yeah, as we know that not only young people that need to go outside, go to get the traveling, but also the elderly itself. Okay, thank you, Miss Astrid, for your good material. So maybe the next session I will please to our audience in here to give your question, or maybe do you need to discuss about Miss Astrid? Okay, Mr. Ngurah Gandhi. Yeah, Mr. Ngurah Gandhi, I think you can open your.
Okay, first of all, thank you for your attention. And my name is Anagung Ragani Setiawayudi. You can call me Gandhi. I'm from Al-Azhar Islamic University, West Nusa Tenggara. Okay, Astrid, I want to ask you that as we know, sometimes elder people tend to be more irritable, and sometimes they also has their kind of paranoid mindset. And my question is, how can we deal with that irritable mood and also that their paranoid mindset when we are going to travel with them, so they can be more enjoy with their holiday or their vacation? Okay, thank you.
Okay. Thank you, Mr. Ngurah Gandhi. I think Mr. Ngurah Gandhi is Miss Astrid's friend. Is that right? Okay. Okay, I can see. Okay, please, Miss Astrid, you can answer directly.
Okay, so it's all about how to deal with the mood irritable, right, Gandhi? Okay, so as we know, elderly throw temper tantrum for a whole host of reasons, right? Often, like very often. I don't know why. I still looking for the answer, but I don't know why. It's a result of the personality changes brought on by, sometimes, as we know, we already learned about psychiatry. It's about Alzheimer's disease and other forms of dementia, right? And certain prescription medication can have sometimes negative side effects of interact with one another, causing mood swings and irritable, like you said. All and according to what you should prepare, first thing is about you have to know first their mental health status. So you have to make an appointment with your healthcare provider or psychiatrist, like what I said, at least 1 month before your grandparents or your parents leave. You have to take care about it and take recommended medicines as directed, and you should more understand about it, more patient, and give more affection to them. I hope it I hope it can answer your question. Maybe, Gandhi, it's already answered. Okay.
I think it is enough for Gandhi. Yeah, thank you, Gandhi. So I think so many support from Astrid's friend, yeah, from Al-Azhar. Okay, the next question from Miss Niputu Wendy, maybe.
Thank you. Thank you for the attention. I'm Windy. I'm from the Faculty of Medicine, Al-Azhar Islamic University, West Nusa Tenggara. Okay, I'm allowed to ask, how do I deal with dehydration in the elderly who are traveling because of a trip? Sometimes people forget to drink and are not hydrated.
Thank you. Yep. Please, Miss Astrid, you can answer directly.
Okay, thank you, Miss Niputu Windy Premanisa. Okay, well, as we know, it can be hard to maintain healthy habits while traveling. Like, there's a lot of euphoria, and then you just forget to drink and something, right? So I know that's why we can dehydration while doing travel for the elderly, especially. So here are several tried, I guess, and tips that can help that we can disciplined on the road. So you can bring a collapsible water bottle. Okay, and then so while during travel, you keep the collapsible water bottle, and you know, there's right now there's something in 1 liter, and you can keep reminding, oh, you should drink at like 11 a.m. and then you just drink it, right? And then the second, start and end your day. Well, start and end your day with water. It's the most easiest things after bring a collapsible water bottle. And then you should avoid dehydrating foods and drinks. So processed foods full of salt and added sugars can actively dehydrate. Like there's a lot of sugar tea, you know, it's you should avoid it while traveling. And the same goes for alcohol and coffee, because they are diuretics. You already, I guess, Miss Putu Windy Pramanisa already learned about urology, right? It's a diuretics for alcohol and coffee. And then this means they cause fluids to pass through your body more quickly. So which can lead to dehydration if not paired with enough water. So you should avoid them. And then I guess you should more eat about rich foods, like who already nutrition that have potassium, like a banana and coconut, I guess, because water are both full of potassium. So maybe that's the answer that all I can say to you. It's already answered your question, Miss Windy, I guess.
Yeah, thank you.
Okay, thank you so much.
Thank you, Miss Windy, for your good question. So the next one and the last, yeah, I think for Miss Putu Cynthia Nanda.
Okay, thank you before. Yeah, thank you for the opportunity. So I want to ask Astrid, but before that, I want to introduce myself first. My name is Nanda. I am a student of Faculty of Medicine at Al-Azhar Islamic University, West Nusa Tenggara. Maybe I want to ask Astrid, if we are going to travel out of town or traveling with our parents or grandparents, do we need a special companion for our parents or not? Maybe that's all. Thank you.
May I already answer the question, Miss Sunny? Sorry.
Yeah, please.
Okay. Okay. Thank you, Miss Nanda, for the question. Okay. So to be honest, that is quite good idea, I guess, to bring you a company. So, but what I'm scared about is elderly helper or accompanied is sometimes forget that they are not the one who take vacation, but the elderlies, right? So, but it's good for the anticipation, plan for the unexpected. It's good to bring the accompanied person to traveling. But as we can see, like what I said in my presentation, there's a difference about elderly people and in developed countries and in developing countries, in developed countries like USA or Germany, that they are already independent and not need elderly helper anymore. Like they don't really need a company person, and it's okay if they're not really needed, because I already met someone who traveling around is just already 60 years old, and she said, I already feel happy if I'm traveling alone, and it's okay because we know she's from elderly people in developed countries, right? And but that's a nice question, because we live in developing countries who's the countries that dependent so much, and it's a good idea to have a company person to traveling. So I guess we need it. So it's already answered maybe Miss Putu Sintiananda Artasi.
Okay. Is it enough for you, Miss Nanda?
Yes, enough. So enough. Thank you.
Okay, thank you so much.
Thank you so much, Miss Nanda. And thank you once again for Miss Astrid for your good answer and good material. So very interesting material. And I'm interested with your voice also. Your voice is very cute, I think, yeah. Mrs. Ayuanulus, do you agree with me?
Yes, definitely. Definitely, Miss Rani.
Okay.
I'm jealous with her voice.
Okay, thank you, Miss Astrid. And all the student of medical faculty of Al-Azhar Islamic University. Thank you once again. And so maybe for this session, I think enough for the second speaker. So maybe for the next agenda, we will meet at 12 and 15 maybe, and after this we can break for a while, so we will meet again at 12 and 15. So thank you so much for our speakers, for Dr. Jul and Miss Committee. You can play the video for break. And maybe for all audience, thank you so much for joining in this meeting Zoom. We can continue our meeting Zoom for 12 and 15. So thank you so much. And maybe I'm sorry if I have some mistake during our agenda. And maybe for our committee, please, you can play the video for a while. Mungkin panitia bisa memutarkan video untuk break sejenak.
Selaku Ketua Stikes Mambal Ulum Surakarta menyampaikan bahwa Stikes Mambal Ulum
Kota Surakarta juga disebut Solo adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Panitia, mohon maaf, videonya belum terlihat.
Sekolah Tinggi nomor 31 status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313/KPT/1/2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi, Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus 1. Menyelenggarakan tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. Ketiga, menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4, menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, minta perhatian.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313/KPT/1/2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan. Dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi. Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus 1. Menyelenggarakan tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. Pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. Ketiga, menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4. Menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, minta perhatian.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313/KPT/1/2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan. Dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi, Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus 1. Menyelenggarakan tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. Pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. 3. Menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4. Menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, minta perhatian. Siap.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313/KPT/1/2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan. Dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi, Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus 1. Menyelenggarakan tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. Pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. Ketiga, menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4. Menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, minta perhatian. Siap.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia. Sekolah Tinggi Ilmu Kesehatan Mabaul Ulum Surakarta atau Stikesmus merupakan gabungan dari Akademi Keperawatan Mabaul Ulum Surakarta atau Akperbus dan Akademi Kebidanan Mabaul Ulum Surakarta atau Akdikmus. Stikesmus berkedudukan di Surakarta. Stikesmus berdiri sebagai wujud pengabdian Yayasan Perguruan Tinggi Islam Surakarta atau Yapertis kepada masyarakat dengan mempersiapkan dan menyediakan tenaga profesional di bidang kesehatan.
Assalamualaikum warahmatullahi wabarakatuh. Saya Sri Iswahyuni SKPNS MKes selaku Ketua Stikes Mabaul Ulum Surakarta menyampaikan bahwa Stikes Mabaul Ulum Surakarta mempunyai 3 prodi. Yang pertama adalah D3 Keperawatan, yang kedua D3 Kebidanan, dan yang ketiga adalah S1 Farmasi. Tahun 2018, Alhamdulillah Stikes Mabaul Ulum Surakarta telah terakreditasi B. Visi dari Stikes Mabaul Ulum Surakarta adalah menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam tahun 2032. Adapun misi dari Stikes Mabaul Ulum Surakarta, yang pertama menyelenggarakan pendidikan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032. Yang kedua, menyelenggarakan penelitian yang unggul guna pengembangan ilmu kesehatan. Yang ketiga, menyelenggarakan pengabdian kepada masyarakat yang mampu mendorong pemberdayaan dan kemandirian masyarakat. Yang keempat, mengembangkan kerjasama yang strategis, sinergis, dan berkelanjutan bagi pihak internal maupun eksternal. 5. Menyelenggarakan tata kelola organisasi yang sehat, akuntabel, berkualitas, yang berkelanjutan berdasarkan nilai-nilai Islam.
Lulusan disiapkan sebagai sarjana yang berpikir secara kritis atau think critically, mampu membandingkan secara logis atau compare logically, memutuskan secara independen atau decide independently, memecahkan problem secara rasional atau solve problem rationally, berkomunikasi secara efektif atau communicate actively, dan mampu memimpin secara meyakinkan atau lead decisively.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313/KPT/1/2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan. Dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi. Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus 1. Menyelenggarakan tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. Pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. 3. Menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4. Menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, bidang perhatian. Siap.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah Provinsi Jawa Tengah, Indonesia.
Visi Stikesmus menjadi perguruan tinggi kesehatan rujukan nasional yang unggul berdasarkan nilai-nilai Islam pada tahun 2032.
Sekolah Tinggi Ilmu Kesehatan Mambaul Ulum Surakarta atau Stikesmus berdiri pada tahun 2017 berdasarkan SK Menteri Riset Teknologi dan Pendidikan Tinggi nomor 313/KPT/1/2017. Stikesmus merupakan perubahan bentuk dan penggabungan dari Akademi Keperawatan Mambaul Ulum Surakarta yang merupakan sekolah keperawatan dan Akademi Kebidanan Mambaul Ulum Surakarta yang merupakan sekolah kebidanan. Dengan penambahan program studi baru yaitu S1 Farmasi. Keduanya merupakan sekolah tinggi kesehatan pilihan di Surakarta. Stikesmus memiliki 4 prodi. Prodi D3 Keperawatan, Prodi D3 Kebidanan, Prodi S1 Farmasi, Prodi S1 Administrasi Rumah Sakit.
Misi Stikesmus 1. Menyelenggarakan Tridharma perguruan tinggi yang berkualitas, profesional, berdaya saing, dan relevan dengan perkembangan ilmu kesehatan. 2. Pengetahuan tata kelola berdasarkan tata kelola perguruan tinggi yang baik, peningkatan kelembagaan, sumber daya manusia, sarana dan prasarana. 3. Menyelenggarakan pendidikan berbasis nilai-nilai Islam. 4. Menyelenggarakan kerjasama strategis dengan berbagai perguruan tinggi di dalam dan di luar negeri, pemerintah pusat, daerah, serta dunia usaha di bidang kesehatan baik regional, nasional, ataupun internasional.
Sambil istirahat, bidang perhatian.
Kota Surakarta, juga disebut Solo, adalah wilayah otonom dengan status kota di bawah provinsi.
Oke, Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, we will continue in the next session. Please have a nice seat. Before I start this session, I want to check my audio first. Miss Sunny, can you hear me?
Hello, Miss Santi. I can hear your voice clearly.
Okay, thank you very much. Thank you for preparing yourself to join the next session of our seminar. I am Santi Irene Putri, the moderator of this session. I'm very pleased to see you here and welcome all of you to this seminar. Okay, ladies and gentlemen, our speaker in this session is Miss Evelyn Langsang. She is one of the students of Visayas State University, Philippines. And the next speaker is Miss Ajeng Wafa Awalia. She is one of the students of the School of Health Sciences, Mambaul Ulum Surakarta. Before the presentations begin, let me inform you how the presentation will be going on. First, Miss Evelyn Langsang will be invited to present the material. After that, there will be a question and answer session, followed by a conclusion. Okay, let me say hello to Miss Evelyn. Hi, Miss Evelyn, how do you do? Hello, Miss Evelyn Langsang, can you hear me? Okay, I will call again. Miss Evelyn, can you hear my sound? Okay, maybe Miss Evelyn need several time to prepare herself. Okay, Miss Sunny, I just want to check my sound. Can you hear my sound clearly?
Yes, we can hear you, Miss Santi. I think Miss Evelyn have a bad connection, maybe.
Okay,
Good afternoon.
Okay, hello, Miss Evelyn.
Good afternoon.
Okay, good afternoon, Miss Evelyn. Okay.
Hello, am I heard?
Okay, thank you very much. Nice to meet you. I can.
Nice to meet you too,
Okay.
ma'am.
I can hear your sound.
Yeah, I think I am experiencing some technical problems with regards to the internet connection.
Okay, it's okay. I hope
Okay,
in
now.
your presentation you will be clearly to show your material, Miss Evelyn.
Yes, ma'am.
Okay.
So let me share.
Okay, now allow me to welcome the speaker, Miss Evelyn Langsang, to deliver her presentation. I would like to invite Miss Evelyn to introduce herself first. Miss Evelyn Langsang, the time is yours.
Okay, is my presentation visible?
Okay, I can see your material. Okay, you can continue, please.
Okay, so before I will start my presentation, let me introduce myself. I am Evelyn L. Lansang, a student from Visayas State University. So I am a fourth-year student in Visayas State University, and Sir Joel Ray Acob uh, is one of my professors in our university. So let me start with my presentation. So my presentation is about the roles of nursing students in the attainment of healthy aging among elderly in the community. So first is that here are the contents of my presentation. So first is that I will first discuss the definition and statistics of elderly population, the roles of nursing students in caring for the elderly. Next is the health needs of the elderly at the community, and the best time to prepare for healthy aging. So let me first start with the definition of elderly population. So according to the Organization for Economic Cooperation and Development, the elderly population is defined as people aged 65 and over. Let me share with you the statistics of the elderly population in the world. So the world continues to experience a sustained change in the age structure of the population, driven by increasing life expectancy and decreasing levels of fertility. So people are living longer lives, and both the share and the number of older people in the total population are increasing rapidly. So according to the United Nations Department and Economic and Social Affairs, statistics indicate that 703 million individuals was age 65 years or older in the world last 2019. In last 2020, globally, there were also 727 million persons who are age 65 and over around the world. So over the next 3 decades, the global number of older persons is projected to more than double, reaching over 1.5 billion in 2050. So all regions is expected to see an increase in the size of their older population between 2020 and 2050. So the share of the global population aged 65 years or over is expected to increase from 9.3% last 2020 to 16% by 2050. Next is the statistics of older population in Southeast Asia. So according to World Health Organization, the population in Southeast Asia is aging rapidly as well. So while the proportion of people aged 60 or above was 9.8% last 2017, it will be increased to 13.7% in 2030 and will also increase for another 20.3% in 2050. Next is the statistics for elderly population in the Philippines. So according to the recent statistics that was provided by the Philippine Statistics Authority, the Philippines has approximately 7.5 million senior citizens as of the most recent census. So the majority of the senior citizens live in Central Luzon and Calabarzon, which is found in the Luzon, so which account for 13.3% of the total population. So Central Luzon has the largest distribution, accounting for 11.6% of the total population. So this is quite obvious because the population in Central Luzon or in the Luzon area is much more greater than the population here in Visayas and in Mindanao. So
Metro Manila also ranks 7th with over 850,000 senior citizens and accounting for 11.3% of the population. Moreover, in Western Visayas, they have 9.4%. In Central Visayas, it has 14.5%. In Ilocos region, it has 11.5%. Bicol region, 10.8%, and in Cordillera Administrative Region is 3.2%, as well as the Bangsamoro Autonomous Region in Muslim Mindanao, which comprises of 1.5%. So, according from the data from Philippine Statistics Authority, data shows that females outnumbered males among senior citizens, in which female comprises of 55.8%, whereas the males comprises of the 44.2%. So let me present to you the roles in caring for the elderly. So as student nurses, our main goal is to promote healthy aging among the elderly. So I have here a little question that you can answer in the chat box, or you could also raise your hand so that you will be acknowledged. So the question is, as nursing students and future nurses, what can we do to promote healthy aging for the elderly at the community setting? So I will read your answers in the chat box. So let me proceed with my presentation. So in here, I have identified 3 major roles in which I have created a mnemonic so that it will be easier to remember. So the mnemonics for our 3 major roles as nursing students is ACE. So first is being an advocate, a counselor, and an educator. So as student nurses, we are an advocate for health promotion. So we work on behalf of older adults to maintain quality of care and to protect their rights. So in our profession, in the nursing profession, advocacy means preserving the human dignity, promoting equality, and providing freedom from suffering. So it's also about ensuring that older adults have the right to make their own decisions about their own health. So as student nurses, we are here so to guide them on what they should do to maintain their health towards aging. So whatever their decision as student nurses, we are there to respect their autonomy, their rights to choose on what health care or what care they would want to make. So for example, advocacy ranges from lending older adults a friendly ear to providing additional information when they are trying to decide whether or not to accept treatment. So our role as student nurses is to listen. So as we all know, older adults are often left at home because their family or their family members, their grandchildren are often at work, and sometimes they are left at home alone with a caregiver. So as student nurses, we should know how to assess, and so we should also know on how to listen about their feelings so that we could know on what care they would want to avail. So as patient advocate, nurses must provide support in an objective manner. So we must be careful not to show any signs of disapproval or approval of their choices. So we let them choose. So we must exercise the rights of to choose their own, so autonomy. So being an advocate for your patient also implies that as student nurses, we will be there to support their decisions. So we must also keep in mind that patients are not always able to fight for their rights. So they need someone to fight for them. So it is us, student nurses. Next role is that we should be a counselor. So as a counselor, we provide support and care to our patients who are the elderly. So counseling is a process of helping older adults to recognize and cope with stressful psychological and social problems, to develop improved interpersonal relationships. So it involves providing emotional, intellectual, and psychological support So as a student nurse, I have observed that older adults are commonly they are retired, so they already underwent retirement from their work. So sometimes under being a retired citizen, sometimes they find it hard in their lives na they feel like they have no purpose in life anymore because they don't have work anymore. So it is our duty as a student nurse, it is our role to guide them emotionally, intellectually, and psychologically. So we will give them support, like we could suggest that that they could do other activities that would improve their quality of life, like gardening or um, helping them find another hobby that they could still enjoy even at their age. Next is we should, as a counselor, we should also learn how to build rapport. So rapport is one of the important factors in order to be an effective counselor. So nurses, student nurses like us, should build rapport with older adults in the community so that they could open up and share their concerns. So as a counselor, we could help patients and their loved ones deal with feelings and frustrations they have towards an illness. We could also be an assistance in explaining some treatment options if they wish to. Next role is that nurses as an educator. So of course, our primary role as nursing students is about health education on preventing injuries and illnesses. So through education, it increases individuals' knowledge of health and healthcare and makes them informed about their healthcare choices. So there are some prophylactic health behaviors, just like physical activity, eating healthy food, having enough exercise, and enough rest and sleep. So these activities keep older adults' lives active, and it will delay them in going through illnesses, and these activities could also increase their satisfaction with life. So as an educator, good communication skills are also important. Learning and using effective communication techniques may help us build more satisfying relationships with older patients and become even more skilled at managing their care. So let me proceed with the next slide. So in here, what are the health needs of the elderly at the community level? So the health needs of the elderly at the community level is they need a source of health care, they need security and safety, mental health, and a good quality of life. So let me proceed. So with regards to the source of healthcare, there are three biggest challenges to accessible healthcare for the elderly. So first is the capability to afford the healthcare visits. So as I have observed here in the Philippines as a student nurse, most of the Filipinos, um, especially those who are living in the rural areas, choose to not do yearly healthcare visits because of some financial problems. So they choose to just do not go to hospitals, and they choose to avail traditional healing, just like what we call here as hilot or massage, because they don't have the enough um, financial aspect in order to afford healthcare visits. Next is the ability to afford transportation. Also, as I have observed, those who are living in the rural areas here in the Philippines do not have the ability to afford transportation. So it is our role as student nurses to inform them where they could find their nearest rural health services, or where they could avail health services, just like rural health centers, because they, even if it's not a big hospital, they could still do healthcare checkups there. So next is that the feeling of not being sick enough. So as I have observed as Filipinos, we usually do not go directly to hospitals if we don't feel like we are sick enough to seek for healthcare. So sometimes when we have fever, cough, colds, or experience body aches, we do not go directly to hospitals. We choose to go to traditional healers to avail healing, and we also choose to prepare herbal medicines. So as student nurses, we should also accept no the fact that we should accept the fact na traditional healing is also applicable. So as student nurses, we should, I think our role is to help educate them na it is better to, prevention is better than cure. So they must have yearly healthcare so that it will not become worse, because as an illness become worse, the finance that will be the financial aspect will be at a higher cost na if the illness is already at the worst stage. So aside from healthcare accessibility, another important issue is the ability to treat disease early and prevent suffering from chronic conditions. So chronic diseases and non-communicable diseases associated with age and triggered by behavioral risk factors. So as student nurses and future nurses, we must guide the elderly and teach them about the importance of yearly medical checkups, because it is important that they could have early detection and prevention of diseases, because with their age, they are more their immune system are more compromised compared to us who are in the younger generation. Next is that elderly need security and safety. So safety is a major concern when working with or providing care to older adults. Although older adults compose approximately 11% of the population, they account for approximately 23% of accidental deaths. So a report from the National Safety Council reveals that approximately 24,000 people older than 65 years old die from accidental injuries serious enough to disable them for at least one day. So ensuring safe living environment for the elderly is crucial as to prevent injuries from falling, particularly those who lives independently and with minimal supervision from family members. So as we all know, older adults are more susceptible to accidents and injuries than our younger adults because of internal and external factors. So some of the internal factors include the normal physiologic changes with aging, increased incidence of chronic diseases, increased use of medication, and cognitive or emotional changes. For the external factors is that some may include variety of environmental factors that are present hazards to older adults. So as future nurses or student nurses, we must know how to assess health hazards that could affect elderly in the community setting so that their safety will be at the priority. Next is that older adults need to have a good mental health. So according to the research findings from World Health Organization, it shows that approximately 15% of adults aged 60 and over suffer from mental disorder, mostly from dementia and depression. So mental health is very important because it affects how older adults think, feel, and act as they cope with their daily lives. So mental health determine how older adults handle stress, relate to others, and make choices. So there are, I will provide some examples on how older adults could possibly promote or improve their mental health. So these examples are like they could engage in physical activities such as exercise, jogging, Zumba, or any activity any activities that they could still manage to do with their age. Next is that they could also engage in gardening. So as older adults that are left at home, they could engage in gardening so that they could use gardening as their new skill and hobby so that they could be distracted from negative thoughts that they are thinking. And the next is they could also stay connected with friends or social groups in their community. And also, older adults must have enough rest and sleep within the community. And lastly is that older adults need to have a good quality of life. So life is more than the avoidance of dependency. As student nurses, we want to promote quality of life, which goes beyond mere autonomy in performing ADLs. So quality of life or good quality of life may be needed as functional health combined with life satisfaction, a feeling of competency, and a perception of social support. So as mentioned earlier, there are some ways in order so that elderly could improve their quality of life. Retirement stage, they could still be useful to the community by finding a new hobby, by trying new activities that they could do, like gardening, going into social groups in the community with their age. So next is that I will discuss about our research findings. So our research is entitled Perceptions of Middle-Aged Adults in Barangay Santa Rita Samar and Barangay Del Carmen Norte towards healthy aging. So I have this question. When is the best time to prepare for healthy aging? So based on our research findings, the best time to prepare for healthy aging is between young adulthood to middle adulthood. So preparing for healthy aging at an early age as possible will be a big factor to have a healthy process of aging because the things that we do when we are younger will then reflect once we grow older. So for example, if as a young individual or in the middle age adulthood, we smoke. So when we grow older, we all know that smoking affects our lungs. So if we do not correct our habit of smoking at an earlier age, it will be difficult to correct the damage as we grow older. So we will have lung problems. So based on our research, our participants find it good to start having a healthy lifestyle or to go with the healthy aging as early as possible. So as young as we are, we could already start living healthy. So the participants of our study were between 35 to 50 years old. So our participants have not been medically diagnosed with diseases nor had any recent hospitalizations due to certain disease. So the purpose why we conducted our study so that we could describe the perceptions of middle-aged adults towards healthy aging, as well as we could know the activities that they usually do to maintain their health. So in our research, we found out three major themes that were derived from our study. So first is maintaining healthy practices. Second is promoting psychological and social well-being. And third is sustaining health for support system. So all these three major themes lead to one end goal, which is to have a healthy aging. So let me discuss our first theme, which is maintaining healthy practices. So in this theme, our participants describe their perceptions towards healthy aging and the activities that they do to attain healthy aging. So all our 20 participants believe that it is important to maintain healthy practices. So the first theme, this theme is focusing more on the physical attributes of an individual. So during the interview, it was clear that it is important to maintain our physical health to avoid diseases and illnesses. So this theme, which is maintaining healthy practices, could also be related to the theory of health promotion by Nola Pender, which states that a person must engage in healthy promotion activities to prevent illnesses. So in here, we had 6 activities that our participants have mentioned in order to maintain healthy practices. So first, they mentioned that it is important to have regular exercise. So regular daily exercise is very important because they think that when they sweat, they burn fat and they release the dangerous toxins or harmful toxins in their body. So it is important for them to have regular exercise. Then the next is eating healthy and nutritious food. So our participants mentioned that they enjoy eating fruits and vegetables and they avoid eating fatty and salty foods, which they think could be dangerous for the body. The next is that they think that it is important to have intake of vitamins and supplements that could be beneficial for the body and could help the body as well. The next is they have mentioned to avoid vices. So as I have mentioned in my example earlier, our participants find it important to avoid smoking and drinking alcoholic beverages as young as they are so that they will not experience the negative effects as they grow older. Next is they put emphasis on having enough rest and sleep as well as having adequate hydration. So these sub-themes that were developed for this theme, maintaining healthy practices, can also be related to the biological theories of aging. So based on this theory, human beings undergo changes as human beings continue to age. Therefore, the detrimental effects leading to a reduction in function and other age-related changes that occurs as a person ages can be prevented by maintaining a healthy practice of a person. Next is the theme 2, which is promoting psychological and social well-being. So this theme is centered to the overall social and psychological well-being of a person. So this theme is further divided into 4 sub-themes, which is having a good social relationship, avoidance of stress, having strong faith in God, and the influence of social media. So with regards to good social relationship, our participants have mentioned that it is important for them to have a good relationship with their neighbors in the community because with having a good social relationship, it could lead to our second sub-theme, which is the avoidance of stress. So our participants have mentioned that they have observed that when they do not have a good social relationships with their neighbors in the community, it will just cause them stress. So mental stress. So with this, they also avoid stress because they have mentioned that they think that stress could be one of the factors why our immune system would be low, or stress could also be one of the causes that they could acquire illnesses. The next is having a strong faith in God. So our participants mentioned that they that God is the main person which is in charge of their life. So they subject everything to God. They pray to God to give them good health and a longer life. Next is the influence of social media. So our participants uses social media like Facebook, YouTube, and watching television so that they could get some knowledge on how they could further improve their well-being or their health. So they have mentioned that they are fond of watching YouTube videos which talks about health and wellness, and they would also apply it in their lives. And the last theme is sustaining health for the support system. So in this, the participants described their perceptions towards healthy aging, and it was clear that they must maintain their health to live longer for their support system, such as their kids and family. So in here, they mentioned that they need to live longer. So in this team, our participants mentioned that they are motivated to maintain their health, their optimal health, so that they could live longer for their family. So they have mentioned that they still wanted to see their grandkids and their children grow up. So they use their family as an inspiration so that they would have a healthier life or to live longer. So our research findings is important as student nurses because we would already know what healthy change we will provide to older adults in the community or even younger adults in the community on how they could prevent illnesses or diseases at a younger age. As mentioned or based on our study findings, it is also important that our we think our research I and my partner for this research think that our study findings is important also develop other programs that could help adults improve their health and well-being. So that is all for my presentation. Thank you.
Okay, thank you very much, Miss Evelyn, for giving us such an informative and interesting presentation. You explained about how nursing students to promote healthy aging for the elderly at the community. Okay, ladies and gentlemen, now come to the questions and answer session. I would like to have 3 questions from the participants. Okay, any participants will ask to Miss Evelyn? I see my friends in this virtual meeting room, Miss Ayu Anulus and Miss Corey. Do you have any questions for Miss Evelyn? Okay, Miss Evelyn, while waiting for the questions, have you, as a nursing student, had an experience when implementing health management for the elderly in the Philippines? I mean, a special experience to an elderly with disability or others. Can you explain that?
Okay, so hello. So as a student nurse, I have experience providing care for the elderly in the community setting. So and also as a first experience, I am also living with my grandmother, which is already so old. So as a student nurse, I have applied my learnings in school at our home. So I have provided care for my grandparents. So my grandparent is already 88 years old, in which she experiences, she often forgets things. And then she also has diabetes mellitus. So as a student nurse, I have experience that I take her blood glucose level at home, and I have applied my learnings at school. And also, I could, based on our research findings, I could relate to it, or my grandmother could relate to it because I've asked her, how what did she do so that she could reach the age of 88, which is already an old age. So she told me that when she was younger, she didn't engage in any vices. She always considers having enough rest and sleep. She avoids stress, and she likes eating healthy fruits and vegetables. And then I have realized na really elderly needs security and safety because as elderly are prone to having falls. So um as a student nurse, I have observed that um older adults older adults and other family members go at work and their grandkids go to school. So for me, I see it as um, something that student nurses or future nurses in the community should look into, because what if the older adults in their house experience falls, and then no one could rescue them because they have no one in their house. And then the source of healthcare also, as I have experienced in our community, my personal experience is that I've heard elderly na they said that they could not go to yearly checkups or medical visits because they really could not afford. And sometimes they think that the transportation or the fare going to healthcare visits will just add on to the expenses that they could already use to buy their food. So as a student nurse, it is important, to encourage them to have even once a year for yearly medical checkups, because um, so that they could know about their health conditions. And as a student nurse, I also recommend we will teach the people in the community, especially the elderly, about the importance of healthcare. So as student nurses, we should inform them where the nearest healthcare centers are located, so they don't need to go to the city to acquire for checkups.
Okay. Okay, Miss Evelyn, thank you very much for your sharing experience about your grandmother. This is such amazing. You as nursing students. Okay, I see Miss Ayu Anulus and Miss Astrid Duarsa. You were able to on cam, please. Any questions for Miss Evelyn? Okay, I think there's no questions for Miss Evelyn. Thank you very much, Miss Evelyn. We hope we still have the opportunity to be able to discuss of the next opportunity. See you later, Miss Evelyn. Okay, ladies and okay, thank you so much. Nice to meet you, Miss Evelyn. Okay, ladies and gentlemen, we will listen to the presentation of the last material from Miss Ajeng Wafa Awalia. If you have questions for Miss Ajeng, you may raise your hand and turn on your microphone and ask her for or use the chat feature in this Zoom meeting, and I will read your questions after material presentation. I would like to welcome Miss Ajeng as our last speaker today. Hello, Miss Ajeng. How are you today?
Good, Alhamdulillah. How are you?
I'm fine, thank you, Miss Ajeng. Excuse me, Miss Ajeng, can you speak loudly?
Okay, I'll try.
Okay. I will invite Miss Ajeng to chat a bit before she explain the material. It seems that this is the first time for Miss Ajeng to share her experience in the extraordinary seminar. How do you feel, Miss Ajeng?
Okay, in here, I just want to tell my experience or something about me for studying in Stikes Mambawul Ulum Surakarta.
Okay, so Miss Ajeng, are you ready to presentation your material today? Okay, Miss Ajeng, the time is yours.
First, I apologize in advance. Here, I don't have anything that needs to be shown through a presentation. I am also sorry how later I'm not very good at speaking English because I am also in the middle of learning how to speak English well. Okay, first of all, I would like to appreciate all the speakers at this seminar, a very great material that I can receive at today. Also want to thank you for the great opportunity to allow me to speak at this international seminar. What a cool experience. On this occasion, On this occasion, I want to tell you something about me and my experience while studying at Sikas Mambaul Ulum Surakarta. I would to introduce myself first. My name is Ajeng Wafa Awalia, a fourth semester student who comes from Sikas Mambaul Ulum Surakarta. I came from Wonogiri, Central Java. My high school origin is from SMA Negeri 1 Jatisrono or Jatisrono High School 1. A little about me. On June the 4th, it will be exactly 20 years old I live in this world. I am the first child of 2 siblings. I have one younger brother who is 10 years old. Then I have a little interest in reading novels, such as one of them by Colleen Hoover and Valerie Patkar, a writer from Indonesia. I'm also who has interest in watching Korean drama and some series Netflix, like this. Next are some of my experience in high school. I have served as a secretary in 2 organizations and 1 extracurricular for 2 years. From that experience, I have a little interest also in writing. I have a small blog, and I'm also currently writing 3 stories on one of the writing platforms. It's been a long journey until I finally decided to study nursing at Sikas Mambaul Ulum Surakarta. Before that, of course, many people thought I wasn't very suitable in this field because they saw some of my hobbies and interests that were into conspicuous in the world of health. But deep down, I became a nurse, one of my dreams, science junior high school. Or science, I heard that my brother has a kidney disease, which is quite tribal. Almost every week, I think almost every week I go to the hospital and meet many nurses there. For years, I have seen and witnessed how the hospital team have done for my brother recovery. And from there, I was able to solidify my desire to carry out my postponed dream again. I decided to study nursing with the aim that I wanted to help the healthy warriors out there to get their smile back, get back to their dreams with incredible health. I want to be able to work in the pediatric nursing department later and help children return to health in their life. Until finally I study at Sikas Mambaul Ulum Surakarta, my experience while carrying out field practice in hospital was extraordinary. I learned many new things there, starting from putting infusion, mixing drugs, treating clean and dirty wounds, and colostomy care. And also, there was one extraordinary case that impressed me, namely when treatment of Stevens-Johnson syndrome. This extraordinary experience gave me a lot of new lessons. And I participate in several organizational activities such as BEM, or Student Body, where I served as the Communication Informatics Division. I have done a lot of activities with my organizational friends, and don't forget to be with one of our supervisors in running this organization, Mr. Aris Widianto. Activities that I participate in organizational are such as health educational to several college in Central Java, Indonesia, community service, scientific work week, teaching revision, and also journaling literature, and visiting several high school in Surakarta. I think that was some of the activities. And how about me? I did with my organizational team. I hope what I tell you all can motivate the participant here. That's it. I think that's all I can say. Thank you for the time and place given. At the same time, happy meeting with fellow speakers at this seminar. We share a lot of experience that we hope will be useful for all of us. Thank you for your keen attention to my speech. I am sorry if there is any word or my behalf which unpleasing you all, and to the God I beg for a forgiveness. Good morning. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Miss Acheng, for your introducing yourself. All right, now we will move to the question and answer session. I would like to have 3 questions from the participants. Okay, Miss Acheng, while we're waiting for the questions related to the theme of our seminar today, can you explain about your experience during college, especially in studying management in the elderly and the community? Okay, Miss Acheng, do you stay connect with me?
Okay, sorry, Mr. Sandy. I think I don't have many experience. Yeah.
Okay, can you explain us maybe a special experience related to your practice as a nursing student or others? Okay, while waiting for Miss Acheng, maybe Miss Ayu Anulus or Miss Kori. I see you still on Zoom meeting. Would you like to give some questions, or would you like to make a discussion with Miss Acheng? Okay, Miss Acheng, I will back to you. Are you ready to explain your experience? Maybe you just share your special experience that different from others' experience.
Experience for me, I've been to nursing home there. I found a lot of old elder people who really need nursing help from us. Therefore, we as nurse must be able to handle this. I hope we can, as a nurse, must be able to handle this.
Okay. Okay, thank you so much for your answer. Okay, ladies and gentlemen, we finally come to the end of this seminar. Before I close the seminar, I would like to take the conclusion from what the speakers has presented. I can conclude that students should improve their general conception of rehabilitation and health management as it relates to an aging population and community. Students' understanding of aging phenomena and problems of the elderly, including functional problems and the effects on the body, intellectual, and mental health system will be able to assist them in providing the best health care. Deepening rehabilitation and healthcare policies, clinical and community level work in combination will address the problem. Okay, ladies and gentlemen, I represent the entire extended family of the School of Health Sciences Mambaul Ulum Surakarta, and the committee would like to thank the speakers for the informative and interesting presentation and all the participants for their very nice participation. Finally, give applause to the speakers and you all. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. See you later.